have a really, really interesting guest today. It's actually something that I'm very curious about because at Nutritional World, excuse me, we have about 300 people come in a day. And for 42 years, I have listened intently to people's concerns about health. I am, of course, from the world of believing so strongly in foods, the power of, and in supplementation to create optimal health. But I constantly have people ask me my opinion, and they say, I've got a hernia. Is there anything you can do or we can do to help the body be better at that? And I say to them, actually not. There's not anything nutritionally that I know about that can truly do anything for something like this because it's really a structural issue. So today we're going to be talking with Dr. Shah, who's a general and bariatric surgeon from CHI Memorial. Welcome to Vital Health Radio, Dr. Shah.
Yeah, good morning. Thank you so much for having me on.
I guess initially, tell people again what a hiatal hernia actually is.
So a hiatal hernia is, let me start kind of back a little bit. The hiatus is something that everybody has. Your esophagus, connects your mouth to your stomach, and it travels through the chest. And the diaphragm is a muscle that separates the abdomen from the chest. So the diaphragm has to have a hole in it for your esophagus to go through, otherwise you would not be able to swallow. That hole is called the hiatus. Now, in some people, the hiatus gets larger over time, and it allows more than just the esophagus to go through, and sometimes people have part of their stomach come up into the chest, and some people, if it's been going on long enough and if that hole is big enough, can have even other organs go up into their chest instead of being in the abdomen. And, it's not 100% known why this occurs, but the thought is that people who have some sort of chronic high pressure in the abdomen, either people who have to constantly strain for bowel movements and create that high pressure, or for other reasons, they will develop these over time.
Interesting. And let me ask a personal question before I run out of time. Does lifting heavy weights, which both Dr. Green and myself are very devoted to the gym. I'm 63. I've lifted heavy since I was 14. Does that contribute to this?
I don't believe I've ever seen somebody be a fit, weightlifting person come in with a hiatal hernia. It's usually in the older population, people who are not active actually, but again, we don't fully understand all the reasons behind the occurrence of hiatal hernias.
Maybe you can tell some of the listeners, the symptoms that they're going to feel if they have a hiatal hernia, some of the medical therapies. I'm assuming you don't rush straight to surgery just like we in primary care don't. We run straight to our medication since we're not cutters. But if you can discuss that with the listeners, what are they looking for to see, do I have one or not?
Sure, yeah. So, of course, one of the big things that many people suffer from is acid reflux. And you can imagine that if the end of your esophagus is not in the right spot, and if your stomach is being pushed up into your chest, the anti-reflux mechanism of your esophagus and your stomach is altered. So one of the first things people complain about is acid reflux, and it can be pretty severe. They can not be able to sleep flat at night. They might have voice changes. Some people with bad enough reflux will have chronic lung problems because the acid goes down into their lungs. So that can happen with some of the smaller hiatal hernias. And many times that can be helped with just acid blocking medication, such as a proton pump inhibitor, which many people are on. Once the hiatal hernia gets larger, it's hard to control those symptoms necessarily with just medication. And some of the new symptoms that can occur is what's called early satiety, or getting full early, having a feeling of food getting stuck in the chest. As hernias get larger and larger and more of the stomach comes into the chest, you can also have twisting of the stomach. You can get pain with eating. You can have blood loss from poor blood flow coming into the stomach, and so people can become iron deficient. They can have low blood counts. And then the most feared and emergent symptoms are extreme pain, where the stomach can actually twist on itself and kink off its blood supply. And that would be an emergency. But that, luckily, is pretty rare.
How interesting. I never even had any ideas that the problem could decrease blood flow to a point where you actually would become nutritionally deficient. How interesting. All right, so we've know that it's a structural issue. This isn't about poor health. It's not about not eating well. So what kind of new ideas do we have, or you have, for helping a patient when they get to this point?
Well, the surgery to repair a hiatal hernia has been around for a while, but my training specifically, I come from Cleveland Clinic, Florida. My training specifically is on how to do it minimally invasive with minimal disruption to your natural tissues. I have learned techniques there that allow me to repair the hernias without using a mesh. And the mesh, we have found that with many different things, anytime you place a foreign object around the junction where the esophagus and the stomach join each other, there tend to be complications after that. So from the bariatric world, there was the adjustable gastric band that is kind of fallen out of favor. And that has caused, in many people, scar tissue and narrowing of the esophagus and stomach, so people can't swallow and they have to have the band removed. Or one of the newer things more recently is the LINX procedure, where they place a magnetic ring around the bottom of your esophagus for people with reflux. I've seen many of those have to be removed also for scar tissue. And then, of course, with mesh for a hiatal hernia, this is a portion of the body that has to move all the time. You're swallowing throughout the day, and your body wants to scar foreign objects. It wants to remove foreign objects from the surrounding area, and the way it does that is by enveloping it in scar. So if you scar down this area of the body that has to be very mobile, that has to swallow and open and shut and move, and if you scar that down, people can get strictures and narrowings and have issues swallowing. So one of the things I've learned is how to repair these even large hiatal hernias without the need of mesh.
I so appreciate that angle because, again, not by any means saying I'm an expert in any area but nutrition, but I honor the processes of the human body to the ultimate degree. Every decision I make personally, or if I'm giving any education to someone, is to work with the body and not create some artificial impasses. This is literally working with the body with such common sense and wisdom that it's stunning to me. I am going to put your name in my phone, so when the day comes with my age that I have a hernia, I mean, you almost make it sound so good. I want to get it done now, and I don't have a problem. So wonderful.
I appreciate that.
I love your philosophy because you are honoring the body, and that's what I really wake up for every single day, is to help to also do that with other people's education. So what is the recovery's pretty quickly?
Yeah, so it's done minimally invasive. So I'm sure people know friends or family who have undergone a gallbladder removal laparoscopically. So the recovery from this surgery would be similar to a gallbladder removal. The only difference is that I ask people to be on a pureed diet for 4 weeks. Reason being is that I've just worked on this connection between the stomach and the esophagus. There's going to be a lot of swelling there, and we just need time for the swelling to go down before people can eat more of a regular diet. But other than that, minimally invasive, people go home the next day after surgery and can get back to life pretty quickly.
I'm super impressed. And I know this is my angle. Could they drink a meal replacement drink if they wanted that?
Yes, absolutely.
Okay, because we really...
I had a teacher who used to tell patients, if you want to throw vodka and a hamburger in a blender, as long as you blend it, it's okay. I don't agree with that, but that's kind of the idea. As long as it's baby food consistency, you can have it.
Okay, because I'm a huge believer in nutritional drinks. I've drank my breakfast for 5 years. I don't eat it because I think we can do far better by drinking good quality products than we can choosing foods often. So what as far as the people who are listening right now, if they don't have insurance, is this still an option? Could that work? Because see, I'm an amateur in all of this. I don't know.
Well, that's always a difficult question. I know that CHI Memorial, that one of their mission goals in the community is to serve the health of the community. So they have avenues to help people even if they don't have insurance. And, I would encourage people to come try to get checked if they're able to. Of course, if you come in emergently, which I hope is not the case, then the issue of insurance is not a problem. But I feel lucky to work for a nonprofit hospital system that does care about the community and would be able to help out.
That's lovely. And so people with insurance that have the normal paperwork requirement, they're having
right.
Maybe they're thinking they have this problem. Do they need to go ahead and go to their general practitioner first, or can they call you? What's the process?
So usually the way to diagnose this issue, say rather than just having acid reflux without a hiatal hernia, is usually an endoscopy. You go to your gastroenterologist. They will perform an endoscopy through the mouth, take a look into your stomach and your esophagus. And if there is concern, then we move to X-ray or CT scan type imaging to confirm the diagnosis. Again, the majority of hiatal hernias are the simple, what we call type 1, where just a little bit of the stomach is entering into the chest and then will go back down even. And those usually are treated with medication. It's when the hiatus continues to get larger and more of the stomach comes up is a surgeon necessary.
Okay, that's great information. So how would the person, if they want to learn more and get in touch with you, what would they do?
So my office is at the main Memorial Hospital on Glenwood Drive. That number is 423-698-8692. And they can ask their primary if they feel that's an issue. They can set up an appointment with me. I'd be happy to see them.
Well, that's wonderful, wonderful information, Dr. Shah. And please, if you're by Nutrition World on Lee Highway, bring some of your cards, because sometimes people will lose the memory of how to get in contact with people they listen to on this show, and I would always keep those at their disposal. So, again, thank you very much for that, and have a great rest of the day. It is time to take a break. When we come back, we'll be talking more about your health and nutrition. That plus everything to come. For Dr. Green, I'm Ed Jones, and stay with us.